Good afternoon. I'm Jennifer Homendy, and welcome to the first of many roundtables that I'll be hosting this summer and fall, focused on the need to transition to a safe system approach to prevent fatalities and injuries on our nation's roadways. As many of you know, protecting vulnerable road users through a safe systems approach is on the NTSB's most wanted list. But our recommendations, which stem from our investigations and our studies of emerging safety trends, go far beyond pedestrians, bicyclists, and motorcyclists. If implemented, our recommendations would improve safety for all road users. See, I believe we have a responsibility, a duty as a nation and as safety leaders to ensure that everyone who interacts with our vast transportation network is safe, whether it's in our skies, on our rails, on our waterways, on our roads, or throughout communities where people live, work, and play. But before I get too far, I think it's important to take a quick look back at traffic safety in the United States. In 1966, President Johnson signed the National Traffic and Motor Vehicle Safety Act and the Highway Safety Act, which were two of the biggest steps our nation took to begin to address road safety. When the legislation was signed, there were 50,000 fatalities on our roadways. During the signing ceremony, President Johnson stated the goal of the legislation was to cut down on the senseless loss of life, pointless injury, and heartbreak that the nation was experiencing. At the time, he said that if our nation didn't do something soon, out of every two people in the United States would be injured by a car during their lifetime. The policies and frameworks established by those laws led to significant safety improvements, many of which the NTSB strongly advocated for. But while there has been progress in safety, it's been slow. And over the past decade, things have been generally stagnant. And then in 2020, we saw something we never expected, something we haven't seen in prior global crises. Last year, many people across the country, including me, stayed home and off the roads. As a result, we saw a 13.2% decline in vehicle miles traveled. That's a dramatic decline in VMT to levels that haven't been recorded since 2002. But even with fewer cars on the road, we saw an increase in fatalities. NHTSA reports 38,680 lives were lost in 2020, the highest number of fatalities since 2007. The National Safety Council, whose numbers I prefer a bit better because it includes not just public roads, but also private roads, parking lots, and driveways, report a bit over 42,000, and that's just fatalities. Millions more were injured, many seriously injured. I haven't seen statistics from NHTSA yet on injuries for 2020, but the National Safety Council estimates nearly 5 million injuries occurred, and crashes resulted in about $474 billion in damages. In other words, we are less safe on our roads, and we're going in the wrong direction. So what can we do as a nation? What can we do as safety leaders? That's what brings us here today, to discuss how we can save lives. While President Johnson wanted to cut down on fatalities and injuries, we need to be even more ambitious in our efforts. We need to find ways to completely eliminate fatalities and injuries on our roads. Some people say it's not possible. I say, why not? For nearly 40 years, the traditional 4 E's of traffic safety, education, engineering, enforcement, and emergency response have helped save lives, but they aren't making the progress we need now. If we're going to get to zero, we need a paradigm shift in how we think about road safety and how we address road safety. So what does that look like? My colleague on the board, Tom Chapman, held an introductory roundtable on the safe system approach in May. It was a great event, but for this one, I want to take a step back. We need to start with, what is a safe systems approach? How does it differ from conventional road safety efforts? What lessons can we learn from international partners who are far ahead of us in implementing a safe system approach, And what steps can we take now to save lives? Over the next several months, I'll host additional roundtables to really dig into the components of the safe system approach: safe roads, safe vehicles, safe roadway users, safe speeds, and post-crash care. And we're going to hear different views throughout the series, some of which you may not agree with, some of which I may not agree with, but everyone's voice needs to be heard, or we're never going to improve safety for all. So with that, I am so excited to get things started with an amazing group of panelists. And I invite the panelists to go ahead and turn on their cameras. We have Dr. Wendy Weermars, who is a senior researcher and research manager at SWOV Institute for Road Safety Research in the Netherlands. Wendy has been involved in a wide variety of road safety research projects related to road safety monitoring and road safety forecasting. The sustainable safety approach, or as we think of it, safe systems approach, and road safety performance indicators. In July 2019, Wendy became head of the department, focusing on research related to safe infrastructure. Internationally, she's regarded as a leader in road safety. She has been involved in several EU projects, including something I hope lots of folks will read, the OECD report, Zero Road Deaths and Serious Injuries, leading a paradigm shift to a safe system. I'm also pleased to have with us Linda Bailey, who serves as Vision Zero Director of Washington, D.C.'s Department of Transportation. Prior to her role at DDOT, she served as Executive Director for the National Association of City Transportation Officials, where she worked and continues to work with a vast network of transportation officials from large US cities to develop strong national policies based on best practices in various aspects of transportation policy. Prior to joining NACTO, Linda worked for the New York City Department of Transportation, where she played a key role in developing the agency's Vision Zero program. I'm also pleased to introduce Dr. Jamila Porter, who leads the Big Cities Health Coalition's efforts to build healthy, resilient, and vibrant communities across our nation's largest cities by utilizing expertise in systemic equity, racial justice, violence prevention, and policy. Prior to joining the coalition, Jamila was Director of Programs and Evaluation at the Safe States Alliance, a national association dedicated to strengthening the practice of injury and violence prevention. I want to introduce Dr. Laura Sant, who is a Senior Research Associate at the University of North Carolina Highway Safety Research Center and the Director of the Collaborative Sciences Center for Road Safety, one of the 5 national UTCs funded by the FAST Act in 2016. Laura's primary focus area at UNC is conducting research and developing guidance related to multimodal safety and health. If you weren't aware, UNC is doing a lot of great work on safe systems and utilizing complex system science to improve road safety. And finally, we have Leah Shayam, the founder and director of the Vision Zero Network, a national nonprofit campaign supporting communities working towards zero traffic fatalities and severe injuries. The network helps communities develop and share best practices for safe mobility for all road users. Welcome, everyone. I am very excited about this panel. I want everyone to sort of think about how you would describe or define a safe systems approach. But first, we're going to turn to Wendy for a short presentation on sustainable safety in the Netherlands.
Thank you very much. And thank you for this kind invitation to join this roundtable. I'm very happy to be here. And I'm very happy to provide this introduction. So I will tell you something about the safe system approach in general and about sustainable safety, the Dutch version of the safe system approach in particular. The safe system approach was not invented by road safety. Before it was applied to road safety, we started applying it in the 1990s. But before it was applied to road safety, it was already applied to other areas like industrial safety and aviation safety. And I think this machine nicely explains the concept of a safe system approach. Here you see a machine that is meant for cutting piles of paper. And you see, you have to use the machine with two hands. You have to push two buttons at the same time to be able to really cut the piles of paper. And that's I think the concept of a safe system approach. It's safety by design. The system is designed in such a way that you have to use it in a safe manner, that that errors are prevented as much as possible, and that people use it in the way they cannot be harmed. So that, I think, explains the concept of a safe system in a very brief way. I would like to mention two reports that are written by the OECD. Already, one of them was already mentioned by member Homandy. In 2008, they wrote a report Towards Zero. That was, I think, the first report by OECD about the safe system approach. And then in 2016, we wrote the report Zero Road Deaths and Serious Injuries. And at the moment, there is a new OECD working group working at a third report on the safe system approach. And that's focusing on really implementing the safe system approach, and also in developing countries. And whereas the other two reports are more focused, I think, on developed countries. I was a member of the editorial group of the second report, Zero Road Deaths and Serious Injuries. And in that report, we state the following. The safe system approach to road safety starts with the ethical imperative that no human should be killed or seriously injured as a result of a road crash, as the blame is partly on the system. And once this ethical imperative is accepted, we can no longer blame the victim or the driver. We have to change the system. So that's the start, I think, of a safe system approach to road safety. And we also, in the report, we did a number of case studies, and we tried to learn from countries that already made the paradigm shift to the safe system, like the Netherlands, but also Sweden, Australia, parts of Australia, New Zealand. And from the examples, we concluded that a paradigm shift to a safe system is possible, and that the safe system approach can lead to significant reductions in casualties and risks. We did an evaluation of sustainable safety in the Netherlands, and we found really large reductions in casualties. And that a safe system approach is cost effective. In the Netherlands, we also looked at cost effectiveness, and the impacts, the road safety benefits are 3 to 4 times higher than the costs of the measures. However, it is important to monitor, to evaluate, and to update the vision and the approach and the measures. And we also found that each country should follow its own journey. So what works in one country doesn't necessarily works in another country. So how to get to a safe system? In my view, and that's also what we concluded in the 2016 OECD report, a shift to a safe system is more a social, political, and professional challenge rather than a technical or economic challenge. And the most important thing is to have strong and sustained leadership, to create a sense of urgency for change, and to convince and involve all the stakeholders in the paradigm shift. So something about the Dutch experience. In the Netherlands, the safe system approach is called sustainable safety. We started working on sustainable safety in 1992. In that year, the so-called Purple Book was published. And the vision is updated twice, in 2005, 2006. That was Advancing Sustainable Safety, an updated version of the safe system of sustainable safety. And then in 2018, there was the second update. But there were some new elements added, but the main core of the vision remained the same throughout the time. There are three things that are in the core of the sustainable safety. First of all, it's a proactive approach, which means that you take measures before crashes occur. So you don't wait for crashes and take measures on locations where crashes occur, but you make sure you take measures on locations that are not safe or that you prevent risks that could lead to crashes. It's a human-centered approach, which means that you adopt the system to the humans. You look at the limitations, the capabilities, and the characteristics of humans, and you develop the system so that it takes the capabilities and limitations of humans into account. So, for example, in the machine that was for cutting piles of paper, you know that people are wanted to do things quite quickly, and they are, if they have only one button, they are easily putting the pile into the machine with one hand and having a risk of being cut. So you design the system in such a way that you take that into account and that you prevent errors. And it's a systems approach, which means that you look at the system as a holistic thing, and you look at all elements of the system together, and you take combinations of measures to prevent crashes. So in a sustainable, safe traffic system, infrastructure is adapted to the capabilities and limitations of road users. Vehicles are equipped to simplify the driving task and to offer protection. Or as we stated in the report, the road and the vehicle protect you and those around you against major traffic hazards. And road users are educated and informed, and driving behavior is regularly checked. So in that way, the different elements of the system are adopted, or developed or designed in a inherently safe way and working together to prevent crashes as much as possible. Now, I would like to show a short movie that explains the basic principles of the safe system approach.
Improving road safety is important. In a sustainably safe road traffic system, no serious casualties occur. To prepare for the future, we are working on a shared road safety vision in which human factors are key. The vision is based on 5 principles ensuring a safe trip. Functionality of roads, with each road having only one traffic function. Biomechanical principles to protect the physically vulnerable human. And psychologics to ensure the design of the road traffic environment is well aligned with road user competencies. These 3 principles are driven by effectively allocated responsibility for all parties involved, and by continually learning and innovating in the traffic system through research of crash causes and effective road safety measures. Together, these principles gear towards a maximally safe traffic system. For instance, if we don't want crashes to occur due to distracted drivers, we need to protect drivers from being distracted. Roads should have only one function and should have a safe road design. The central government, road authorities, and the industry need to take responsibility for effective improvements. Research and knowledge dissemination ensure we keep learning and innovating. With these 5 principles, we continually contribute to a sustainably safe road traffic system, while taking our mobility needs into account in the present and the future, en route to a casualty-free road traffic system. Improving road safety in a sustainably safe road traffic system, no serious casualties occur, is important. To prepare for the future, in a sustainably safe, we are working on a shared.
So that was my final slide. I wanted to go to the to the final slide that shows. Thank you for your attention. But that was my brief introduction to the safe system approach and to sustainable safety in particular. Thank you for your attention.
Well, thank you, Wendy. And I think the one good thing that I can say about this new sort of telework environment is it has brought people together that wouldn't normally be possible if we didn't have this video capability. So I really appreciate you participating today. And please, others, turn on your cameras. And I also want to invite everyone to just call me Jennifer. For our audience, none of this is going to be scripted. In advance, I sent out some sample questions just to get people thinking, but essentially what we want to do today is have a conversation about safe systems, the safe system approach. And why I think that is so important is I don't want it to just become a tagline. I want people to understand what we're talking about, what is envisioned by a safe system approach, what steps we need to take to get there, whether it's on the federal level, state, or through communities. We can talk about all the issues that Wendy brought up, but I just really appreciate you all joining us. Someone on Twitter said we have a rock star panel. I totally agree. So with that, I will say yesterday on Twitter, I'd put out a question. What do you believe a safe system approach is? Just to get, some responses. And I thought none of them, no response is wrong. A lot of people had some great things. A safe system is one that has been designed holistically with safety first at all levels. Safe system in its simplest form, anyone should be able to navigate their way around the community without having to worry about their safety. So I could go on and on. So many good responses, and I really appreciate the conversation back and forth online that I have with folks. But I want to get your take. What's your take on what does a safe system approach mean to you? How does it differ from where we've been? Where do we need to go? Who wants to go first? Maybe I'll pick on Leah first, since she's to the right of me.
Sure. First, thank you so much to the NTSB team and Jennifer and Romney for bringing us together. This is so exciting. Gosh, I know we're all going to have great definitions. I'm going to start kind of picking up from something, Wendy, that you talked about, the human-centered approach. I think at a very high level, that summarizes it quite well. Human-centered approach. Now, what does that actually mean? To me, the two things that jump out most, it's not the only thing, but the two things that jump out most, number one, it's shifting from this focus on individual behavior and responsibility to the system's responsibility, right? So really looking more upstream at what are the systems that are in place, the roadways, the policies. So yes, we as individuals have responsibility. We do. We should be safe. We all should. And the system needs to be built safely. So I would say, unfortunately, we are reaping I wouldn't say bad, the reaction or the actions or results of a system that's not been built mainly for human safety. It's been built for speed and such. And then secondly, quickly, really shifting to recognizing, hey, people are going to make mistakes. Humans are fallible. Let's not pretend otherwise. Let's not delude ourselves. So how do we help create the system that makes those inevitable mistakes, whether intentional or not? How do we help that system be more forgiving and not fatal? I'll stop there.
That's great. I will go to Jamila.
Thank you. And again, I would like to echo a huge thanks to the NTSB team, to you personally, Jennifer. Thank you for having me here. And also on this lovely, just wonderful panel I'm so glad to be a part of. I couldn't agree more with the Twitter messages that you read, Jennifer, and also with Leah's assessment as well. What I'll add to that, in addition to agreeing with all that, is that absolutely my view of a safe system is much more expansive and holistic, as someone had tweeted. It is a system that is safe by design, and it is intentionally meant to protect those who are the most unprotected. So, or the most likely to be unprotected. And again, as Leah noted, it's about looking at the system as a whole and not at individual behavior, because the way the system is designed is integral and has the most responsibility for keeping people safe. I think another element to add would be that I see a safe system as one that is the ultimate application of the curb cut effect. And for those who have not necessarily heard of that, it's a term that was uplifted by the disability rights community, where advocates fought to get curb cuts put into sidewalks, which benefited those who were disabled, who were physically disabled, but also helped parents pushing strollers, workers pushing carts. It's just a better place to cross, even if you're a able pedestrian. So when we design to improve the safety of those who are most in need, everyone benefits. And I think the other part of a safe system is that safety is not only the commodity of certain people, certain areas of town, but it is truly belongs to all of us. And so I think in a safe system, there's not a dangerous side of town and a safe side of town, but there's the system itself across the entirety of the network is safe, and everyone has equitable access to that safety and that comfort and freedom.
Wow, great comments so far. We'll go to, and I'm going in order here, just on how you are on my screen. We'll go to Linda next.
Thanks, Jennifer. It's a pleasure to be here with everybody today. Great panel to be part of. I think something, so I'm in the District of Columbia in Washington, DC, and so we're a city agency. And I think something that I talk about a lot when I speak to the public about Vision Zero is that we want to design our streets so that it's intuitive to drive safely, because that's kind of a key element. I think people often want to blame the individual and blame behavior when we address a specific crash. And I always say there's multiple factors that go into every crash. There's almost always some behavior element you can point to, but there's also a system element, and that's what we can affect. That's our, my agency's domain. So we try and address that, our piece of the system. And it is so important to zoom out into the system, and I feel like it's a constant challenge. I think this is the only thing I'll add, and I agree with everybody else's definition also. I think we're all in the pretty same ballpark, but I'd say in the profession of transportation professionals, it's a constant challenge to design from almost from a different principle than previously, which was really about maximum throughput, maximum speed.
Laura.
Yes, and I will just echo what a pleasure it is to be here today. I have learned so much from the women on this panel and just really appreciate the opportunity to have this conversation. And I guess just to add a little bit more nuance to the responses we've already heard about what is a safe systems and how is it different. I would definitely echo what we saw in Wendy's presentation and video about that human-centric approach. And to me, it's not just moving from acknowledging the human's, culpability or, role in crashes, as Leah mentioned, but I think it's that designing for that human in the system and designing for that full range of capabilities from the child, from the person with cognitive or physical limitations, to the person that is aging, and to make sure that we have a suite of options that fits that human need for travel to get from one place to another safely. And in terms of what we've done in the past, I think we, as others have already said, we've really focused on vehicle movement. We count vehicles, we count vehicle miles traveled, we've designed for different vehicle types, we design our roadways to accommodate certain vehicle sizes and speeds. And we haven't taken advantage of all the great research on human behavior and psychology and human science and public health to understand people's vulnerabilities and their limitations and how they, how that system needs to really adapt to accommodate humans. And humans are changing. We have a lot of different changes to our population and our health and where we live. And so I think that, that adapting the system to meet the human is a really large task. And again, I think this is just a great conversation to be having.
Thank you all very much. Really, really tremendous points. I liked what you said, Linda, about zooming out and comments about holistic approach and being human-centric. And, one thing I would ask if Wendy, can you chime in a little bit about some of the barriers that you all faced in the Netherlands to moving towards a sustainable safety or safe systems approach for us, and some of the challenges you may have faced, but then maybe facing now?
Yes, when we started we did some research on barriers. The main barrier that is there all the time is financing issues. We know that measures are cost effective, but the effects, the road safety benefits are they're over a longer period of time, and there are benefits, also societal benefits, and the measures have to be paid in advance. So it's always difficult to find money to really implement the measures. In the beginning, when we started implementing sustainable safety, we had quite a nice solution, I think, for that, is that we had the measures had to be taken at the municipal level, and there was not enough money at the municipal level. So they made an agreement with the national government that the part of the measures were going to be subsidized by the national government. So 50% of the measures, the 50% of the money came from the national government, and the other part of the money came from the municipalities itself. And that was really effective. There are also some other barriers. There are also some other interests, for example, some other stakes. If you look, for example, at a road design, from a safety perspective, it's important to have safe shoulders, and you have an obstacle-free zone that's quite large. But there are some roads with old trees next to it, and those trees are good for nature, and they have historical value. So those kind of barriers also exist. And then also a new challenge is that are more and more elderly people. And in the Netherlands, they bike a lot, and they also use electric bicycles. And it's very difficult to design the system in such a way. We have a lot of single bicycle crashes in the Netherlands. More than half of all serious road injuries is due to single bicycle crashes. So that's a huge new problem, and that's quite a difficult problem to solve, because those crashes are really difficult to prevent, because the bicycle you easily lose balance. You're not protected by the vehicle itself, so it's quite difficult to solve those problems. So that are just a few barriers that we are still facing. And another thing is maybe good to mention, that we did really well in road safety for quite a long period. We were, if you look at number of casualties, we were one among the best performing countries in Europe. But at the moment, actually, if you look at the progress in road safety, we were last in Europe. So we did worst of all European countries. And that's also because we did quite well before. So there was less attention to, if you're doing well, then there's going to be less attention for road safety. And it's difficult to keep the momentum and to really keep the political attention as well, to keep on investing in road safety.
Yeah, well, it's difficult to get people's attentions focused on road safety other than us in the US as well. We hear about terrible tragedies in other modes of transportation, and we immediately focus on those, but sometimes the road safety, many times, often road safety can be neglected in the US. So it's hard to keep that constant attention. But and feel free, the other all the others here, the other panelists, feel free to jump in. I don't feel like I have to call you or you have to raise your hand, but I do want to hear from you on what you think are potential, barriers and challenges with sort of the traditional approach and barriers and challenges to getting us to transition into a safe system approach.
I'd love to share a thought. I think at a really core foundational level, recognizing and naming this problem has not happened to the degree it needs to. So thank you again, NTSB and everybody here working on this and all the folks watching. It's as if there is this, complacency about the issue. And that's not to say that we aren't all working really hard. We are, there are very dedicated safety advocates and political leaders and engineers and planners and health folks and, law enforcement folks that are out there with the goal of safety. Absolutely. But we've really created this environment where it's almost understood tragedy of 40,000 traffic deaths a year. And we talk about it going up or down, 5%, 10%. These are human lives, right? And just to put it in perspective and say, traffic deaths are the leading cause of death among youth in this country. How is that not outraging people? And I just I'll share one quick thing. I honestly was listening to the radio news this morning, and as every newscast for the past week, they were talking about the tragedy in South Florida with the building collapse, the condominium collapse, which is of course a terrible tragedy. Perhaps 100 or so people expected lost and killed that. And there's so much attention on what happened and the investigation and who knew what when and predictability. And it deserves that attention. But I thought that is the number of people, about 100, maybe a little more, about 100 people that will die today in the US, walking, biking, driving to work, to school, to the grocery store. And we are not paying anywhere near that much attention on it, whether that's media or frankly, political leaders or policy changers. And so how are we helping people, A, recognize it as the problem it is, a crisis, and then recognize that we do have agency? And I think that's what, hopefully today and Safe Systems can focus on. But I think a lot more of us need to be recognizing it, naming the problem, and shaking off this complacency.
Great answer.
I'll add to that, that I think, Leo, when you were talking about the numbers, that those numbers don't have real tangible meaning, I think, for a lot of people. I think what we run into with road safety is that we run into some norms and like some deeply held beliefs that are challenging. One is individual responsibility. That is sort of a US value. And it's hard to help convey even to decision makers that this is a systemic problem, and it is not an individual person's responsibility and error that is the cause of the larger system being the problem. I think the other piece is that we've normalized this, right? So there's an expectation of death on roads. It could also be about the numbers, that sometimes it's one or two people, a vehicle, a pedestrian here, there, and not a huge loss of life at one time. But there's also this sort of expectation that this is just part of the risk that you calculate into road travel. And so that runs counter to the Safe Systems sort of concept around zero loss of life is acceptable. And so I think we have to figure out how to reconfigure those values into long, deep-seated American values, where if we're talking about freedom, for instance, that we're talking about, we want freedom for everyone, that safety, looking at this systemically, is actually the key to freedom as opposed to the limitation of it. And so I think there's just these norms that we run into, and that we as across sectors and fields need to connect and collaborate on to make sure that the Safe Systems approach is actually feeding into the values that we already know are there and are really deep-seated and long-held.
Great. Linda?
I think, hey, I know Laura had her hand up too, but I'll be quick. So something that jumped out to me, I was thinking through your presentation, Wendy, and about what went on in the Netherlands with the advent of this program, and you talked about, the safe drivers and testing of drivers, which is, I'd say, something we have a lot of room to improve on in the here in the district, but also nationally in the U.S. And that kind of ticked for me in my mind, though, also the fact that we really don't have a great multimodal system for most people across the U.S. So most people live in, I think, a slight majority of people live in places with basically no transit, and then a very small proportion of people in the U.S. live in a place with really good transit where transit is a viable option. And that means two things. We're doing a lot of really good, cool transit stuff here in DC. We're doing a lot of kind of improvements to our bus system on the street side to try and really improve our surface transportation, because there are parts of the district that are not easily accessible by metro, which is our rail transport system. And I see that as all vision zero, because that's allowing people to reduce their exposure to motor vehicle traffic. It's a super safe mode in itself. So if that's the mode somebody's using, it's really beneficial. And frankly, it also means that people with time are going to be more willing to take away somebody's driver's license. Right now, nobody really gets their I shouldn't say nobody, but it's very difficult to get somebody's driver's license suspended, because they're most of those kind of decision makers are reluctant to do so for good reason, because people need their vehicles to get around and need to be able to drive in many places in the US. And that just means we really are lacking kind of a major tool for educating and kind of holding drivers to
I'll just add a little bit more to this conversation, in that I think some of the differences too in the US versus what we've seen in other countries is, we expect quick fixes, rapid responses, and huge changes overnight sometimes. And a lot of communities, if they have a safety concern, their first impulse is to call enforcement, because that's a quick, visible reaction to a problem. But when we look at the work that's going on in other countries, it's long-term. It's not work that happens within one political cycle or one administration. It took years and years for them to develop just some of the basic data and data performance standards that they're applying. And we haven't really talked about the long game, or set the expectation for what this looks like in the long term, because I think a lot of our focus is on what can we do tomorrow, what can we see that we can explain very quickly to the public, and we don't really appreciate the time that it takes to really address the root causes of complex challenges. And pedestrian and bicyclists and all of our transportation safety issues that we're talking about are very fundamentally complex. And we often sort of fall into thinking about what is our individual, technical skill that we can add and address through engineering. It takes a lot more time to build a language with somebody from public health, or from data science, or from land use planning, to really see kind of the bigger dynamics, that bigger system, and what the opportunities are. And so we've kind of been playing at the margins and taking the low-hanging fruit, but at some point the work is going to get harder and deeper for us to really get that kind of paradigm level shift that we've been talking about.
Well, and go ahead.
I'll jump in with one thought. I agree with you absolutely, Laura. And I'll say sometimes that thought daunts me. I mean, much daunts me, I'll be honest, but that daunts me. I want to maybe add a layer that I hope will encourage us. Because there's so many times that we think, oh, that's Europe, or oh, that's another country. Oh, in America, we do it this way. And it's true, we have some challenges and other great things and hard things, right? But I don't want us to think like, oh, we can't do that. And I think for me, part of the encouraging piece is the fact that whether it's, practitioners like us, like researchers and health people and leaders and such, but also that the people on the ground. I know every one of us, is involved in some local advocacy efforts where, sadly, maybe it's someone who's lost a loved one or been involved in a terrible incident where they've been hurt, or we know people who have. But I do think there's been this really there is happening a shift where this isn't just a policy discussion and isn't just like a debate up here. And I want to really encourage people watching too to say, it's most likely to be ground up. I think it is happening ground up. So you listening have as much power, on your streets at your city council meeting and talking to your electeds and going to meet your engineer and bringing a bunch of school kids out to, talk about safety on the streets, as we do up as somebody does at the congressional level in some ways, right? So I just want to really encourage, I think part of this is demystifying that this stuff is handled by, super smart people at some high echelon. It's all of us making change at the ground. So I hope we can keep doing that.
Well, and just to add to that, I do think as leaders in safety, I think it's our responsibility as well to kind of uplift some of those voices that haven't been at the table, who haven't been part of the discussion. In the past, I kind of look back at my career in transportation safety, and I see a lot of organizations that I repeatedly work with who I love to work with. But then I have to step back and think about, who have I not worked with? Who are we not hearing from? Who is not at the table? Who are the communities, the people who aren't here, talking about the importance of safety? And so let's talk about that for a second. How do we get, underserved communities or marginalized communities, or really just anybody who hasn't been brought to the table to work on road safety? How do we make that happen? So there are discussions. A lot of times in these sorts of discussions, we like to hear sort of like-minded thinking. I personally like to hear different views. We have to welcome that, because if we're not having that discussion, we're not resolving, some of the biggest issues we are seeing in our nation's transportation network. So how do we do that effectively? Any thoughts?
I think that's also a big issue and a difference that we see in the US is we do have such differential in power and privilege in who is at that table. And there are some wonderful thinkers out there that have been really raising the level of awareness and the sophistication of this conversation around power and privilege in our systems, and the systematic bias and exclusion. And I think that's, those are conversations that I see happening in all places, whether it's in the research community, in the planning community, in the safety community. Whose voices have we been ignoring, and whose voices do we need to pay attention to and see that as valid and important data? Because I think we've long deferred to engineers, the engineering profession, as Leah said, sort of the controller of the system, the designer of the system. And I think when we saw the critique of the MUTCD in the recent public comment period, what we saw was not just a critique of what was in the MUTCD, but the process by which these recommendations were made, and who was making them, and who was on this panel and who was not on this panel. So at every level of research and design and policymaking, we are talking about diversity, inclusion, and equity, and that is a very important conversation to be having if we want to make systems that work for all people.
Yeah, what came to mind from you while you were talking, Laura, was when Wendy in her presentation talked about how the shift is a social, political, and professional challenge. But we don't necessarily, I completely agree with that. And I think that we don't necessarily talk about it like those sorts of challenges. We do talk about road safety in a more technical sense, and not about how this is a social and political transformation that's required to shift culture, to shift sort of these values right around road safety that have really been solidified over the last century. I think when we talk about the way you phrased it, Jennifer, in terms of who's not at the table, I think people are challenged with that question because they can't think of the people that aren't at the table. It's so hard. I think the number one group that we almost never do, and we play, sort of that we are, but we're not, is the community, right? Communities that in which the roads exist, who have had to live and endure traffic fatalities for decades and decades. And the way that communities have been engaged in the past has been, at best, ignored, really, right? Like sort of just on the checklist, we had a community meeting. And at worst, they've been lied to. So I think, there's a dishonesty at the core that we're gonna have to work through, right? Acknowledge that, be transparent and humble about that. But then also, moving forward, having to engage communities with honesty and letting them drive some of this. I think there's always at the heart, and I appreciate Leah's sort of like grassroots thinking around it, but I often see that the decision is already made. The developer is going to do what they're going to do. The engineer, the plan for this road network is already good. We're just sort of going through the motions. And so if we're going to do that, then we're not honestly engaging communities or community-based organizations that could add such immense value to this work and also help us get to the root causes like Laura had mentioned. So I think we have to really, it's about process, and we have to rethink the process by which we are making these decisions and the power and privilege that has been baked into those processes for decades, and figure out how we're going to give that power back to the communities that live in the places that we're trying to transform.
And I really appreciate, Jamila, the phrase of be transparent and humble. I feel like those of us in the transportation profession, whether we're like core in it or ancillary on it somehow, there needs to be more transparency and humility. I'm honestly shocked at the number of meetings that I'm in where people are fighting the concept that there's a connection between our everyday transportation system and inequities from a racial and income perspective, or even gender perspective. And, as if there's this well-meaning everyday transportation system that is completely separate from the ongoing many systemic inequities in our society, right? So even if we don't know how to fix that, not starting by acknowledging that there's connection there, I think there's a lot of room to improve there. And then being honest, and I can say, I know in our Vision Zero, pretty young Vision Zero movement, that we haven't, and I will acknowledge it, that we haven't, especially early on, been aware enough of overlaps of issues. For instance, and Laura mentioned, and I appreciate, the issue, concern of, say, over policing or racial disparities in policing, and how that is absolutely connected to traffic safety issues, right? And in the beginning, to say, oh, that's a different issue. Of course, they're not different issues, right? Even if you have all the good intent in the world, from a traffic safety perspective, I think a lot of us, and myself included, are learning, okay, how does that connect to general public safety? And I need to move beyond my lens of living and learning to understand that. So I want to say one positive. I really want to commend the U.S. Department of Transportation right now seems to be shining a brighter light on these issues, especially when it comes to data and recognizing that we have such a dearth of data and equity focus on data. So they have a call for information right now. So I encourage people to check it out online. The deadline is July 22nd to make recommendations on how to have more equitable data kind of collection and analysis and usage, which I think could be a big help. So I hope people chime in there.
Well, I'm glad you raised some of those things, Leah, because something that Linda said about zooming out, I think so many issues in, society, if we step back from road safety, so many other social issues or, political issues or just, professional challenges, going back to Wendy, influence road safety. And it's really stepping back from just road safety and looking much more broadly at what are some of those issues those challenges that we need to include in addressing road safety. So, you know, it's interesting, Leah, I was looking at one of your documents on advancing Vision Zero, and it said it was talking about the spectrum of prevention and a framework developed by the Prevention Institute, which emphasizes that the culture, community norms, and behaviors isn't driven by individual decisions alone. It's the result of a web of influences from policy to organizational practices to community education. And I couldn't agree more, because I think all of these, you know, whether it's policy or legislation, all of that influences individual decisions and influences how we're addressing road safety. So I didn't know if you wanted to talk about that for a second, because I really thought that document that you all put together was fantastic.
Thank you. And a huge credit to the public health world, Jamila and others that are, I feel like we at least for me in this transportation safety world, mobility world, we have so much to learn from the public health world. I'm not saying it's perfect, but there's so much in the approach. So that idea, and thank you for sharing that, Jennifer, it's really thinking like, how do we think more upstream? And again, the safe systems, that's really what it's about, right? It is literally saying, how do we create and support and maintain systems that are the things that incentivize and encourage people, individuals, to do the good thing, the safe thing, right? And to not, you know, do something that's dangerous. And, you know, looking back and how this is so connected, obviously, to equity, I was obviously saddened to read, but not at all surprised to read a statistic NHTSA shared recently. I'm just trying to find this, that we all know traffic deaths increased. Well, we probably know traffic deaths increased last year significantly, awfully, even though fewer trips. Amongst Black people in the US, traffic deaths increased 23%. That was the highest increase. And they named that even though Black people make up 20% of the traffic deaths overall in the country, they only make up 13% of the population. You look at, when you look at local data, it's happened over and over again. Similarly with youth, similarly with seniors, similarly with lower income communities. And you pause and say, well, gosh, you know, that's unfortunate. That's too bad. Yes. And it's absolutely predictable. And we can follow the line back. And it's tragic to say when we pinpoint down, okay, why is that, say, low income community having more traffic deaths, and particularly pedestrian deaths, people dying while walking? Look at the environment. This is where we touched the freeways down, you know, so many years ago. So it has lots of fast moving traffic. This is where we widen the roads and increase the speeds. This is where we don't have complete sidewalks. So to the point of the system, you know, it's as if we're putting the blame on these individuals who are trying to walk, bike, and drive and scoot through these areas, when the areas themselves are literally built for a less safe experience and less mobility and less access. Meanwhile, a lot of these same communities, frankly, we're pushing further and further out related to costs, right? So now you've got to travel an hour and a half to get to work because we've made our inner cities so expensive, et cetera. So that interconnectedness, I think, is key, and really honestly being humble to say, hey, public health folks, come help us out. How do we look at this in a more holistic way?
Well, and that's something I'm wondering, Jamila, if you can talk a little bit about how to look, and maybe Laura too, how to look at it, look at this. What can we learn from the public health community? How do we bring that into the discussions of road safety?
Well, I want to thank Leah for being so kind to the field of public health. I think we all, those of us who come from a public health background, know that we actually have a lot of work to do in the space where we talk about looking at things holistically, how they're interconnected, and basically infusing concepts of equity and justice into every aspect of our work, because that should be the heart of public health. So kind of you, but we also have a lot of work to do. What I'll say though is that I do think, coming from a public health perspective, that focusing on the interconnectedness of everything, that everything is inherently connected is a piece of it. And also, as we talked about, we have to zoom out and see the larger picture. And then also, as Leah alluded to, we also have to look back, because what has happened in the past is not the past. So the past impacts the present today, right now. And I know we don't talk enough about that. And I think that to talk about equity, or talk about any of these sorts of concepts, infused in it, baked in it, and sort of implicit, is that there is a historical wrong that is still having impact today. In the case of our transportation, our road transportation system, it's a combination of redlining policy that was happening at the federal level and orchestrated at the federal level, but implemented locally with support across different levels of government, where neighborhoods were actively denied funds for infrastructure, lending, and housing for decades. And then there's also the Interstate Defense and Highways Act, which provided federal funding for expressways and interstates, but that local leaders were able to decide the paths of those roads, and they intentionally put those roads through the poorest communities, ones that were redlined already and had been for some time, and then also they tended to be Black communities and communities of color, and they were designed to segregate communities from each other. And so this pattern still has happened today. There's data out there that communities, 75% of communities that were redlined in the 30s are still economically disadvantaged, and that impacts investments in infrastructure that touches on what we care about in terms of road safety today. So we do have to look at this big picture and also see how all of these, again, to Wendy's point, social and political dynamics have created the system that we have today. So I love how Laura touched on, we've been pulling it at sort of the hanging fruit, but with the low hanging fruit. But this, if we really want to get to the heart of addressing these issues, this is the hard part that takes time. It takes political will. It takes a willingness to look at our shared national history and work through those issues. And I think that it requires us to, that communities the infrastructure of these communities aren't by accident, they are by design. And so if we do believe that safety and that the safe systems approach utilizes safety by design, then we need to look at the intentional design of these communities and dismantle it and restructure and reimagine it and rebuild it in a way that is equitable. But of course, that is going to require that we acknowledge these historical events and also acknowledge that they are impacting our data, our numbers, our safety today.
Those are great points, Jamila. And I want to also lift up what you said earlier about the critical value of that community connection. And I think by design, that is missing in many of our transportation processes and plans in relation to what we see in public health. In public health, the work is done within the community, by long-term stakeholders that are part of the community that they serve. Whereas what we see most often in transportation is when new plans are being developed, there's often a disconnect. There's a gatekeeper of a consulting firm that's hired to write the plan, and maybe they only have a couple of chances to interact with the community and share back what they hear before they develop that plan and move to the next. And same thing at the legislative level. We see a lot of transportation legislation that has huge impacts on safety that's being, either drafted or motivated by external, industry partners. It's not necessarily being written based on a community need or even advanced by the community itself. And so it goes back to those issues of power and privilege and who is influencing and designing the system and who doesn't have an adequate seat at the table to make decisions that impact their own health and safety as a user of that system. But again, I think we have a lot of powerful examples of engagement coming from public health, and also how data from the community can be used and integrated with other bigger sources of data. So that connection that we can continue to build is really critical at all levels. Again, at not even the decision-making stage, but even earlier when we're talking about how do we train and educate our future professionals and how do we conduct research that will help inform those decisions? How do we integrate those different disciplines and skill sets to engage the public in an equitable way really early on?
And I'll just jump in and second what you're saying, Laura, that like that public engagement is so critical. So I'm in the District of Columbia government. I'm in the minority. My boss and my boss's boss are all African Americans, and we're a very diverse city, and so it's a really different dynamic, I'd say, around race in particular, even though it's a major dynamic still. And I think what I see as a bigger challenge and something they're working really hard on. We've, I think, quadrupled our community engagement group within the agency to do more work with the community, but we still just, it's easy to do a project that the neighborhood is demanding. And when we go out to a community that may be less engaged because of other challenges going on, and it's maybe historically lower income neighborhood with just other things in the headlines that are taking the community's attention, they're not demanding the same kind of things from the agency. And so for us to be able to do those safety improvements and communicate them to the community and work with the community so that people understand why we're doing them. We're actually doing basically an educational series this summer just about what our different projects are supposed to be doing. Because I went out on and met with community members just recently about a project that wasn't well received, I guess, partly because it was so small. We didn't do a big outreach around it. And so we ended up explaining it and spending a lot of time explaining it on the back end, which is totally the wrong way to do it. But it's just like this challenge when you want to do it quickly because safety is important and it's urgent, but you also want to do a really good job of engaging the community. And those are things that I think probably a lot of cities are dealing with. And it's so important to like have in your head, we've got to spend a lot of time on community engagement, or else even though you might engineer things the right way, it's still not going to work, at the end of the day.
Yeah, and I'm just wondering, Wendy, how do you all deal with community engagement? Do you throughout your development of a sustainable safety in the Netherlands, how did you bring in all the different voices to make sure they were being heard?
Yeah, but what we saw in the OECD working group, like I told you, the different countries follow their own journey. And what we see in the Netherlands is that it was more, the attention more came from the researchers and from the policymakers and from the road designers. So involving the public, involving the communities was not such a big issue in the Netherlands. So we saw it in Sweden. In Sweden, the power of the community was really used to get attention for the safe system approach, Vision Zero in Sweden. But in the Netherlands, we didn't really involve the community. It was more from a top-down way of going, and it was more that the road designers and the researchers and the policymakers, they kind of they implemented the safe system approach by themselves. So in the Netherlands, it's not really a big issue. And what you see if you compare the socio-economic, the lower socio-economic areas with the higher socio-economic areas, you see differences in road safety. But I'm not sure they're that large in the Netherlands. The idea is to develop a safe system everywhere. So it's not that a big issue here.
One thing, Laura and Jamila, you brought up the importance of data. And before we get into that, one question I have for Linda is, when we look at countermeasures for improving road safety, we tend to think of an evidence-based approach is looking at what crashes have happened in the past, and let's go after those. Well, we're missing a lot of safety issues if that's what we're just focused on. So how do you change thinking in states and in local communities to stop focusing so much on what has happened, because we have to, Wendy brought up preventing risk that could lead to crashes. Well, just looking, at, and I know this isn't what you meant, Wendy, you meant looking at all risk to prevent crashes. So how do you get, the federal government, states, local communities to do that when they're looking at countermeasures, not just focusing on what has occurred, but really focusing on who's using the system and where risk is?
Yeah, I think a couple things. So yes, the crash-based, I always say crash data is something we're already collecting. And so it's easier than almost any other data we might want to collect because we already collected it. So that's a lot of the reason we use it. Like we could be using speeds, we could be using near misses. There's a lot of technology out there trying to get that kind of information out there. A little more old school version is called the road safety assessment, which is basically just means someone who's been trained in like how should the intersection work or whatever goes out and like looks at it and measures things maybe and makes an assessment absent just looking at crash data. That's really important in places where maybe you're trying to design it for safety for pedestrians, but right now nobody in their right mind would walk there. So there's nobody walking there, and there's therefore no crashes. So like if you're in a place like that, you really need to go out with a proactive view and say like, if I were walking here, like does this sidewalk connect? Is it a really long crossing? It could be shorter, things like that. And I think that kind of road safety assessment is something, or road safety audit, I think it's called, is something that a lot of jurisdictions are using. It can be difficult to figure out how to prioritize that relative to your high crash locations. And then the other source of information, of course, is community complaints or concerns. And again, those are useful, but can be challenging, like because safety or comfort can vary and can overwhelm also the systems and the resources available. And so trying to figure out how to do that. We have a big kind of effort going on right now to kind of revamp how we take those citizen complaints or citizen concerns and address them more fully and more satisfyingly, I'd say, to the public. That's a major source of complaints, I'd say, and probably true for many jurisdictions when people feel that they've perceived a safety issue and in their perception it has not been adequately addressed. That's like a major source of complaint. And it may be legitimate, it may be something that may be not as dangerous as people think, but it could also be something that's legitimate. And like our model is literally not to get to the level of safety that that person wants to feel and wants to see on their neighborhood or their area. So yeah, I'd say those are really the main tools for figuring things out besides crash data. I feel like there's always some kind of goal of getting something else besides crash data that's universal and related to safety. And we're still challenged in identifying exactly what that is and being able to use it consistently in a way that gets us to a better end.
Can I add something to that? What we are doing in Europe lately is we also use safety performance indicators or key performance indicators. Those are sort of intermediate measures that measure certain risk factors. So for example, information on speed, information on drink driving, information on seatbelt use, information on distraction if available, but also information on the safety level of the road and information on safety level of vehicles in the vehicle park. So those kind of performance indicators, I think they can be an additional source to really create the proactive approach. So that prevents you from taking measures only on black spots, but to really focus on areas, and maybe also the areas which are the poorer areas in which the road is not designed in a safe way. If you use the safety performance indicator for the road network, they should see that there should be a sort of red areas. These roads are not safe, so it's important to take measures on those roads and to improve the road design. And maybe also in addition to that, I think it's also important to look at a network level. And you're absolutely right, if it's too dangerous to walk, so nobody walks, you won't find any crashes. If you look at a network level, and also indeed road safety audits can help there as well. You would see that if you look at a network perspective, the system is not designed in a safe way on a network level. So you should, that hopefully shows that measures should be taken to improve road safety. And that maybe also helps to get more attention to convince politicians or to convince the policymakers to take the measures that are necessary.
I think it can't be stated enough that, sorry.
No, you're good. Go ahead, Laura.
Okay. I agree with both Wendy and Linda that we just can't say enough that the absence of crashes is not the presence of safety. And we see a lot of safety performance measures that are based on crashes. And we know that, only maybe 50% of pedestrian and bicycle crashes get reported to the police. And we have many, many more injuries and very serious events that aren't measured. And so if crashes is our only system to give a red flag on safety, we're in real trouble. But I love what I saw in the Netherlands. More than 10 years ago, I was very excited to get to visit SWAV, and they shared statistics that we still don't have in the US. They could share how many miles of protected bike lane they have in their country and how many people can bike to essential services within each community. And they set plans around low speed zones and what proportion of the community is within a low, kinetic energy management zone. And that kind of network level thinking is so critical. And, I could talk to most engineers that can tell you how many bridges we have and how many miles of lanes we have. Almost none of them can tell us how many miles of sidewalk or connected bike lane or protected intersections we have. And so we have big work ahead of us in just compiling our network and inventory level data that can be useful for identifying those safety performance kind of where we are with our network of high comfort facilities.
And I just wanted to add, as I've heard the conversation evolve, it made me think about how we are utilizing and defining the term safety and how that influences the data that we capture. And I was thinking about the story that Linda told a little while ago about the project that wasn't well received with community. And it made me think about the fact that communities have a very expansive definition of safety, right? So they don't look at things in terms of discrete metrics, but are looking at sort of the entirety of the communities in which they live and how they perceive what safety is. So that when, if there is a planning meeting or something around sort of road engineering, that is getting at a very discrete element of safety from their perspective, but is not addressing the larger safety issues that the road safe system is just one part of safety for for communities. And that's not being addressed. I've seen that happen a lot of times in meetings where it's we don't want to talk about this little project you want to talk about. We want to talk about this larger safety issue that we have and how are you addressing that? And if you're, sort of often the response is that's not in our purview. And I do think that's where the partnerships are critical to anticipate that or be this is a priority for this community, let's address that while we're also addressing this thing. And that is, I know, in terms of transportation, there's a very siloed approach, and I would push back on that and encourage much more partnership. Thinking about DC, I remember a story a couple years ago about how in Ward 8, there was a resident killed in a hit and run. And then the next day, 2 residents were lost to gun violence. And so in that same neighborhood, they talked about residents paint their own crosswalks. And so there's some, the idea of what safety is in that neighborhood is distinctly different and more expansive than what might be presumed. So I would say, and also that community probably has a very different relationship with law enforcement in terms of, you know, how transportation usually sees them as partners. So and that is not the case. So I think we have to expand our definition. We have to partner, and we have to, again, let communities drive this. The projects could proceed, the transportation projects could proceed, but we have to address and figure out how to partner to address larger safety issues that we know communities, particularly in large cities, are dealing with by nature of just the density and the other sort of historical issues that we've talked about.
If I could add, Jim, I agree with you, agree with everyone said, and I almost want to boil it down, and this is going more, I will be honest, more micro on traffic safety, but this idea of like, oh, data, we need better data and research. Yes, we do. But we do not need to wait for a bunch of new data and research. We have a bunch of data and research showing a bunch of things that are just, you know, irrefutable. And one is, if there's one thing we could go do tomorrow, or, you know, let's say in the next year, it is lower speeds where we have people mixing. So, you know, are crashes going to happen? Crashes are going to happen, no matter how perfect a person is, no matter how much machine, you know, learning we have, whatever. Crashes are going to happen. And the thing we can control, one thing, major thing we control, is how hard they crash together, right? I mean, it sounds really basic, but this idea of physics, like we're like ignoring the science around traffic safety. And we know that a vehicle, a car, especially a big car, which they are more and more these days, crashing into a human body, at some level, it's survivable. At some level, it's not survivable. And every day we are pouring money and brains into this not survivable scenario, especially in cities. So, you know, different than say a big highway, you know, freeway where it's cars and cars and a lot of safety equipment in those cars. If we're talking about the communities where we're asking people to walk and bike, we're telling people, oh, go on out and get some exercise and do good things for the environment. You know, what mixed messages we're giving, right? Help climate change, don't drive, you know, lower congestion, take the bus, great. But when you go out there, we've designed a street that is literally not survivable speeds. That is not something I can change as somebody walking on the street or driving on the street. That is a system decision, right? And our electeds and our planners and our engineers need to be given or need to give and then follow through on that really basic fact of survivable versus non-survivable speeds. We could do that tomorrow. We could do that over the next year in our major condensed areas.
Well, I think that's really a good segue to, and I wish I didn't have to make this my last question, because I could talk to you all forever. You're going to have to come back at the end of the series and we'll just do a really big one, because I feel like I could just keep talking about this for quite a while. But what is one thing we can do tomorrow, or a couple of things we can do tomorrow to improve safety for all and move us towards a safe system approach? And Leah, you can get a second shot at it, not just so. Who wants to go first? All right.
I'll try. I'll give a thought, because it's connected to what I wanted to respond to Leah with her last comment. I love, Leah, that you talked about transit and climate change and what people should or shouldn't do around that. And the first thing that my mind thought of was that requires people to talk to each other. Folks who are planning out public transit systems have to be talking to people who are planning out road safety systems and road systems, and looking at the entire network and connectedness or lack thereof. So I think one of the things we can do tomorrow is we can commit to engaging with each other intentionally and baking that into how the work gets done. I think, you know, this is very classic public health too, but transportation, we do it as well. That we look at the end goal, the impact, but we don't look at the process. And the process is actually how the work gets done and how we get to whatever the impact is. So it has to be engagement across sectors, across every element, every piece of this that is connected to making this function right and making safe systems happen. We have to talk to each other. We have to make that just the way we do business. And that includes honestly engaging communities and community-based organizations, not in a way that is a checklist again, but like true collaborative governance. The governing gets done, because this is often our public agencies, because it engages community in a way that is meaningful, thoughtful, and just how the process works. So I think tomorrow we could all agree to do that, commit to the partnership and the meaningful collaborative governance of engaging community in this work.
Absolutely, I agree.
You said that so well, Jamila. I was just going to say that, we just have to keep showing up. And I love that in Wendy's presentation of the safe system model there, that learning and innovation is one of the core principles, because I think that is part of the system science approach that we're trying to encourage too, that learning to see the system and to see your role in the system is critical, and the system is always evolving and changing, and we have to be able to adapt and learn from other partners to understand what their role is and how it relates to ours. We have a lot of conversation around the different E's or the different elements within a system, but really the heart of it is those processes and the interconnections between all those elements that Jamila mentioned. And so I think we're trying to just be much more intentional in how we engage as individuals and organizations in those interactions.
Linda, Leah, Wendy, any final thoughts?
I just want to thank everybody who's on this panel with me, because tomorrow we're kicking off internally and the next version of our Vision Zero plan. So this has given me a lot of food for thought, and it's really great to hear from so many experts looking at it from different perspectives. So that's what I'm going to do tomorrow.
And I'd say, think about what you influence, right? Whether you're a street designer in a city, whether you're a researcher, whether you're a federal level, whether you're, in a politician's office, et cetera, in whatever level or aspect you're at, to call out this as a public health problem that is preventable, right? And whether that means, hey, I can help lower speeds in my community, I can redesign this street, or I can go influence federal spending for the next 7 years on transportation right now. Go do that thing that you're well positioned to do. And I'll just say, hey, to the NTSB team, I'll put it out there, I would love to see more focus on everyday transportation of the work you all do. You do wonderful work in so many areas. Let's make sure that we're looking at the everyday transportation system, which you are right now, obviously, thank you, in a more sustained way, because far more people are killed every day, walking, biking, driving, than all the combination of aviation and maritime and other areas where you all have done amazing safety work. We need to shift that systems approach now to the area that affects way more people every single day. So NTSB has a great role to play.
Thank you. Any last words, Wendy?
No, I have nothing to add to that. I think it's a very good conclusion. And in the end, it's the process is very important, but the process is, I think, aimed at having the right measures implemented to really prevent casualties. And for that, you have to make sure the road is designed, the road network and the roads are designed in a safe way, the vehicles are safe, and people are educated and regularly checked if needed.
Great. Well, thank you. Thank you all. Leave your cameras on. Don't turn them off. Thank you all so much for participating. Leah, I couldn't have picked a better comment there about, we do have a public health crisis on our hands, and we do have to take it seriously and shift our focus. And part of that, from the NTSB standpoint, is federal leadership. And I think we have to continue to engage on these issues. And everything you said, I just really appreciate everything you all added to this discussion. I hope we continue the discussions. From the NTSB standpoint, we'll be having several more roundtables in the Safe System series. Our next roundtable will be held on July 21st at 1 p.m. Eastern Daylight Time, focused on something Leah brought up, which is safe speeds. It's a big issue right now. So we are going to focus on that one in our next roundtable. We're going to be going through each of the components of the safe system approach. We're also going to be talking about equity as well. So I look forward to those discussions. But before we conclude, I do want to thank everyone at the NTSB who has really just been part of this effort and all of traffic safety and other safety efforts at the board. I specifically want to thank Stephanie Shaw and Leah Walton from Safety Advocacy. I also want to recognize Brittany Rawlinson from our research and engineering team, who's been part of our safe systems team to develop this series and really focus in on some great issues. I also want to thank the rest of Team 44, which is Eric Strickland and Stephen Stadius, and thank our support folks. Please, and you all, please, turn on your cameras as well to just wave a quick hi if you'd like. Thank our support team, Carl Perkins, Deidre Esters. I'm not sure if James Anderson was part of this, or also I know Jesus did our great graphics, but thank you all so much. You do fantastic work at the board, and thank you all for participating in this. I look forward to many more discussions. This is just the beginning. In fact, there were things prior to this, but looking forward to continuing our relationship and engaging with each other intentionally on these very important issues.